Well, the Panache study was just released. The results were just released. A multinational randomized controlled trial testing a non-neurohumoral, non-hemodynamic therapy for heart failure with preserved ejection fraction, HFpEF. It has been said that HFpEF is the single greatest unmet need in cardiovascular medicine. It accounts for half of heart failure. Heart failure is increasing, HFpEF is increasing, and we have no evidence-based therapies to treat HFpEF. Nothing. And so there's great interest around the world to identify novel therapies to deal with this global pandemic. In this trial, investigators explored the role of partial adenosine 1 receptor agonists, A1 receptor partial agonists in the therapy for HFpEF. Turns out a trial is also underway in HFrEF, heart failure with reduced ejection fraction. Sadly, this trial was negative. There was no benefit. There was no dose-responsive change in the primary endpoint, that being 6-minute walk test distance. In retrospect, the patients had HFpEF. They took the drug. I think the endpoints that were evaluated were appropriate. If there's anything that I might question, it would be the preclinical foundation on which the trial was based. I myself am a practicing cardiologist, but I do preclinical work, and it's incredibly important that we're exigent about the fundamental science basis that we use to build our clinical trials. In this case, it was based largely on ischemic models, a modest number of dogs that had ischemic HFrEF. Some evidence for potentially a skeletal muscle signal, but in retrospect, and of course, hindsight is 20/20, in retrospect, the rationale for a HFpEF trial that largely excluded patients with coronary disease based on an ischemic model of HFrEF in retrospect, might be viewed as a bit of a stretch. So it's not the first time we've been disappointed in a clinical trial treating HFpEF. In fact, every trial that has been conducted to date has failed. So this is not happy news. It's not surprising news. And so it's back to the drawing board to try and find better ways to treat this ever-growing problem.